the 3D digital puzzle assembly for an amplified learning, a comprehensive and a competitive self-learning toolkit. I thank once again for giving me this opportunity. No financial disclosure. So theory has a lot of concepts which has many limitations. When we browse a particular picture like a cavernous sinus or a circle of Willis, or when we verify a lot of books, when we refer, there are so many different pictures even regarding ophthalmic structures. So for a neophyte, to start off, there are so many cognitive confusions as to what it is, because certain structures are not dissectable, like the circle of Willis or cavernous sinus. We never get to dissect in our anatomy curriculum. So we wanted to create practical sessions which facilitate critical thinking and coping skills. So we started to construct three-dimensional models. We read the anatomy and then we constructed the model digitally, the circle of Willis, cavernous sinus, the final model of the eyeball. And we felt that just like the kids who give puzzles, when they put the puzzles together, there is an intellectual knowledge which is set into play. Similarly, if we make 3D puzzles, and can we incorporate to ophthalmic neophytes, be it the undergraduate students or even the first year postgraduate to start the curriculum, is it going to really help in cognitive learning? So we used a digital software called Maya to create these models, and we also rendered the slicing in Cura, because these two are useful for 3D printing. And then by doing this, as you can see, this is a small clip how we created the three-dimensional cavernous sinus, the circle of Willis, and even the eyeball for that matter. We had to read the Cunningham's and Chaurasia and get the angulations all spot on. And this is the circle of Willis model that you can see in my hand here. So we printed the circle of Willis, which was never done before. 3D printing was done for so many things. I'm not able to bring the cavernous sinus model, but we have all the three models with us. So yes. So we used a Fab XL printer and a Fab X Plus printer to print the circle of Willis, cavernous sinus, and even the eyeball model for tactile learning by touch and by sensation. We don't need to mug up, we don't need to cognitively imagine how the anterior communicating artery or the posterior communicating artery is coming and joining with each other. We used polylactic acid material to print the models, and once the final model was arrived, we used a red spray paint to paint the structures depending upon which color that they want to. For example, red for the circle of Willis. So this is a model which I just showed, and this is a cavernous sinus model we have done. Just like an automobile engineer, we can actually disassemble and assemble the parts so that we don't need to have any cognitive blind spot, don't need to mug up the concepts, we can have it straight shot. And even we used real-time angle structures. We try to create the fundus images as original as possible, so that learning is much better in a very cognitive way for a neophyte. So we did the printing with the retina model was printed with a material of thermoplastic polyurethane, and we can see not only we have normal retinal prints, we have autofluorescence, infrared, for a much holistic learning of different pathologies like a flecked retina, fibrovascular band, retinitis pigmentosa, RNFL defect. We also got feedback from 97 users who are the first year postgraduates, and we divided their satisfaction levels into two. Were they satisfied, neutral, or were they dissatisfied when they studied theory, or when they studied theory along with this kind of a three-dimensional tactile learning, when they touched, felt the dimensions of the curves and learn. Pair t-test was used and it was statistically significant. Student satisfaction with three-dimensional puzzles, they had 97.4% satisfaction levels compared to routine classes where they were pretty okay with that also. It was 89.44, but slightly they preferred something, a novel, innovative way, so that especially for structures which we don't get to dissect in the anatomy, this was a much better way of approach is what the feedback was arrived. And all these models are available open access in meh.org.in for my fellow attendees here. You can go there and you can have this model with you, and you can also print this model, the circle of Willis, which you can see in my hand. You can actually print this own model, because the creation part was the tougher one. The model is there in the web and you can print this model. So the economics is, it's very cost effective. This is only 200 rupees, and the eyeball costs 1000 rupees, and the duration of printing is 10 hours it took to print the circle of Willis, sir. 5 hours to print the cerebral venous system. For the eyeball, since we had many structures, it took 30 hours. So puzzle making, when combined with 3D printing, we also can have a different field like an automobile or a computer science engineer, where tactile learning will be the future in neo-ophthalmic pedagogy. So once again, I thank for giving me this opportunity. We are currently working on a complex neuroanatomical brain model as well. Thank you, sir. These are my references.